Senator Gratwick and distinguished members of the committee, I'm Dr. Phil Caper. I'm on the board of Maine AllCare, and I write a regular monthly column on healthcare policy for the Bangor Daily News. We've heard about some of the shortcomings of the American healthcare system by previous speakers, but I would like to talk as a physician about my diagnosis of what the underlying pathology in our healthcare system is. Well, we've heard of the signs and symptoms such as a lot of uninsured people, out of control costs, and mediocre performance of the system. But I believe the underlying pathology goes far deeper. We love competition in marketplaces, and we've tried an experiment in this country going back 40 years. We're the country that relies the most on competition in marketplaces to control costs, increase access, and improve the quality of care. As you've heard, that experiment has been a dismal failure. And the reason for that is very simple. Markets require a willing seller and a willing buyer, as well as good information. Healthcare is the poster child for a market in which there is a huge gap in information between the sellers of services, that is doctors, hospitals, and others, and the buyers of services, patients. And that gap cannot ever be bridged. We go to school for a long time. Many of us have had a lot of experience. No amount of surfing websites containing data is going to be able to bridge that gap. And that is a situation where in markets where there's a huge gap of information between the sellers and the buyers, those markets inevitably become corrupt. A University of California economist won a Nobel Prize in 1991 for pointing that out. Second, we're unique in the world in using commercial for-profit insurance companies as a mainstay in our healthcare financing systems. These companies are publicly traded, share price is king in these companies, and profitability determines share price. So they do whatever they have to, as they should, as for-profit companies, to maximize profitability. And they do it by slicing and dicing people into risk categories. So they can sell to the people who are low risk, that is the young, employed, and healthy people, mostly residing in southern Maine in this state. And the people who are more likely to use health care, they can identify them to try to avoid them by pricing their policies up, perhaps pricing them out of the private market entirely and dumping them into the rolls of the uninsured or into a high-risk pool, which is subsidized and which I predict will quickly run out of money. So this is something they can't change. That's what they do. The largest department of any commercial insurance company is the underwriting department, who are the folks who identify the risks. That's a fundamental underlying pathology. We also have been perfectly willing to consider healthcare a business in this country. That is an underlying pathology. The purpose of a business is to generate wealth for its owners. The purpose of a healthcare system should be more like police protection, fire protection, public roads, libraries, and public schools. Mission-driven, not profit-driven. Finally, by keeping the health insurance companies in a pivotal role in the Affordable Care Act, the act has had to be made enormously complex, 2,200 pages. The Medicare Act is about 12 pages long. Medicare is not an insurance company, it's a public social insurance company. By making the law so complex, the designers of the law, and I support this law because it does a lot of good things, but the designers of the law, mostly in the Congress, have created a law which is incomprehensible to the average citizen. That is why they're having so much trouble getting people to support it. It cannot be understood. I don't understand it, and I've been doing health policy work for 45 years. So it's too complicated.
So
Okay.
wrapping up, yeah.
Okay. Every other country has a system which is popular with its public, its doctors, and its politicians. In our country, the public is angry, they are confused, and they've begun to lose faith in their own physicians because most physicians are now corporate employees or under pressure to meet corporate revenue and profitability goals, in addition, that often conflict with our own Hippocratic oath. So Lewis Carroll once wrote, "If you don't know where you're going, any road will take you there." LD 1345 provides both the vision, the goal, and the way to get there. Winston Churchill is reputed to have said, "Americans will always do the right things once they've exhausted all alternatives." Well, folks, we're just about there. So let's prove Churchill right by enacting transformational legislation, LD 1345. Please read my full testimony. You each have an electronic copy and a hard copy. This article in Time Magazine, a cover story in Time Magazine from last March, is a revealing study of how hospital charges are determined. It's scandalous. This study in Newsweek, this current Newsweek, called "The Myth of Healthcare's Free Market," is something you should also read. There are links to both of these at the very end of my testimony. Thank you very much.